The virus has revealed gaping holes in our nation's healthcare system, and some communities are being hit harder than others. Chris Conti explores what needs to be done in those areas in this next installment of The Rebound.
So it's really diverse.
In cities across the country, there are neighborhoods and zip codes where the virus is hitting hardest. Communities which were struggling long before the emergence of COVID-19.
Well, I think it's created a lot of concern and uncertainty.
Mary Cole lives in one of those places. She's currently sheltering in place inside her home in East Boston, a section of Boston where healthcare and cheap housing are notoriously hard to come by.
We're a working class neighborhood, and a lot of the people in East Boston don't have the luxury of doing what I'm doing, which is to shelter in place.
This working class neighborhood is a myriad of minorities and immigrants. They have been hit harder by coronavirus than most other areas of the city. Why? Many people didn't have good health care here to begin with.
If you don't have a healthcare home, then you don't feel comfortable just walking in and getting the treatment that you need.
That is Manny Lopes. He oversees the East Boston Neighborhood Health Center, a local nonprofit. Many of their patients who might have COVID-19 are too scared to come in for fear their immigration status will be checked, or they'll end up with a hospital bill they can't afford.
A virus like this, and then added with unemployment, unstable housing, just really magnifies it 1,000 times.
And a lack of affordable housing in major cities across the country is only adding to how fast the virus is spreading. When a family of 6 or 10 is crammed into a 600 square foot apartment, there's no place to self-quarantine if someone gets sick. To keep up with the problem, places like East Boston Health are outreaching to patients in multiple languages about COVID. And even if someone tests positive, the hope is that now they'll be more likely to get preventative care in the future.
I worry about people who have to go to work every day.
As the country rebounds from the virus, there's no shortage of issues coming to light. In Boston, I'm Chris Conti reporting.